So I guess one of the biggest drivers is I was not happy at all with the ratio of administrative burden versus time spent. And that gets even worse when you have an electronic medical record, right? The time you spend documenting and the buttons to click and the ever increasing requirements for insurance purposes or justification or prior authorizations, the amount of time I was spending with the computer and with paperwork, I would seriously estimate was about 10 to 1 compared to how much time I spent with a patient. So I felt that going with a concierge model would help change that ratio back down to a more reasonable level. Have a relaxed visit where I can truly get a good, valuable history and make sure when the patient leaves with our plan, they understand the rationale and have buy-in, which is going to increase compliance and improve your outcomes. So it was really driven by prioritization of time. We're here for the patient, not for the medical record, not for the insurance company, and so on. That was really the main driver. Yeah, mixed feelings about narrowing down your practice and becoming a concierge doctor, and that some of your favorite patients will leave because of the fee, and that's really just kind of gut-wrenching. At the same time, I've reconciled that because the patients who stayed with me, and by the way, now I'm just concierge, so just a couple of hundred patients I take care of. The ones who stayed with me, I know they're getting excellent care. So one of the concerns I had when I decided to try to go concierge, and again, this was to scale things back to a manageable level. I'm very compulsive. Trying to be compulsive for thousands of people doesn't work. Being compulsive for a few hundred works. So when I decided to scale back, I thought, oh my gosh, these people are going to pay all this money. I'm going to be stuck with a panel of rich, hoity-toity, spoiled, high-maintenance people. These are the thoughts that went through my mind. Young families that I love to take care of probably won't want to invest that money. And I'm really surprised. If you look at my demographic, I do have some wealthy people. I have some people who are not wealthy at all. So you get a good mix. And so as you make that transition, or you consider making that transition, realize that there are lots of starfish washed up on the beach. You can pick up a few and throw them back in the surf, but you're never going to save them all. It's much more gratifying and I think safer to take care of a few people very, very well than it is to spread yourself thin, burn yourself out, end your career, miss something, get sued, hurt somebody. I'd rather do it small and do it right.